3, 2.
Welcome, everyone, and thank you for joining us for Health Chats. Today, we are honored to be joined by representatives from the College of Nursing, the Elson S. Floyd College of Medicine, as well as the College of Pharmacy and Pharmaceutical Sciences, who will discuss the value of interprofessional education and teaching students to work in a healthcare team. Our guests today are Julie Akers, Associate Professor and Director of Health Outreach and External Residency Research at the College of Pharmacy and Pharmaceutical Sciences. Akers teaches pharmacy law and healthcare systems, among other courses at the college, and has over 20 years of experience working in pharmacy with lawmakers to advocate for community pharmacies and increased patient access to healthcare. In her role as Director of Health Outreach and External Residency Research, she is responsible for executing partnerships for health outreach services that will include student pharmacists as part of a healthcare team. Akers is a member of the Bobby Health Board of Directors, which oversees the Range Community Clinic. She has served as the president of Washington State Pharmacy Association and was awarded the Good Government Pharmacist of the Year award in 2019 by the American Pharmacists Association. Our other guest is Michaelle Guerrero, practice manager for Range Community Clinic. Guerrero joined WSU in February 2020 and runs the day-to-day operations of the Range Community Clinic. Prior to that time, she served more than 20 years in the U.S. Air Force as hospital administrator, leading a wide variety of Department of Defense healthcare facilities at home and abroad. She is board certified with the Health Information Management and Systems Society. Complementing her professional career, Guerrero is also active in a variety of civic organizations, including the American Red Cross Inland Northwest chapter, the Spokane Lilac Association, and leadership in Spokane. Other accolades include Award of the American Hospital Association Special Achievement Award and George Washington University Arthur S. Fleming Award. Our guest from the College of Nursing is Marian Wilson, Associate Professor at the college. Wilson is a registered nurse and current project director on a grant from Substance Abuse and Mental Services, which brings together students from different health professions to practice collaborative care in patients with substance use disorders. As part of the Interprofessional Opioid Collaborative Care Curriculum Core Team, Wilson works with fellow faculty members in pharmacy, medicine, and nursing and social work to create interprofessional education with case studies focused on pain and opioids for students and practicing clinicians. She is certified in pain management nursing from the American Nurses Credentialing Center and the American Society for Pain Management Nursing, and has been funded through the National Institute on Drug Abuse, Substance Abuse and Mental Health Services, Health Resources and Service Administration, and the National Institute of Health Center for Complementary and Integrative Health, studying pain and opioid use and developing interprofessional education programs on the topic. Before we begin, I want to remind our audience that you can always type your questions you have for our guests into the YouTube chat. Also, if you want to hear more about pharmacy and other health-related topics, please hit the subscribe button. And before we start, we have a special announcement from Evan Barton, our recruitment and outreach specialist. Take it away, Evan.
Hello, everyone. Like Connie said, my name is Evan Barton, and I'm the recruitment and outreach specialist for the College of Pharmacy and Pharmaceutical Sciences. I'm happy that you were able to join us today. I really quickly wanted to share that our admissions deadline is coming up on June 1st, 2021 for the fall of 2021. And for those of you who may not be ready to apply yet, for fall 2021, the springtime right now is a great time to start preparing your application for pharmacy school for fall of 2022 for our upcoming admission cycle. You can always reach out to me if you have any questions about applications or admissions at pharmacy.admissions@wsu.edu. Go Cougs.
Thanks, Evan. So our first question for our audience members who are new to the health sciences, what is interprofessional learning? Perhaps we can start with Marian, and if any of our panelists want to chime in, please do.
Yes, hello, and thank you for the question. Interprofessional education is sort of a new concept, at least in the nursing field. It wasn't available when I was training, and it's about learning with others and from others. So by bringing in different disciplines, different areas of expertise, we can learn together, and we can also understand more about what the other disciplines have to contribute. These kinds of exchanges help with our communication between disciplines and also just understanding what each discipline brings to the table and how they can work together to improve patient care.
And Connie, thank you. I'll just add that I think that one of the things that I see the most valuable from interprofessional learning from the student level is not only focused on improved patient outcomes, but it, as Marian said, was learning from one another. There's so much of our scopes of practice between the different professions that have some specialty, but there's quite a bit of overlap. And so seeing those students learn and grow and approach a patient case scenario or a real life patient case and realize that there's a list of activities that need to be done to provide care for the patient, and many of them all could do it. But answering that question of which provider is the right provider in that setting to do it, whether a student from medicine, nursing, or pharmacy can all do many of these activities, like take vital signs and do a review of systems with the patient. But when you look at that kind of holistic care, how do they differentiate and really kind of align with who's going to do what? And I just really love seeing that light come on with the students when they really learn from each other, that their scopes do have a lot of overlap, and really getting to that next level of how to use those skills to provide the best patient care.
And Connie, I'll just add to that with Range, as the clinical practice affiliated with WSU, we are right that chaotic environment where we really see the interprofessional students in action and faculty, right? And so there's continuous learning whether it's the interprofessional students learning from each other, as both Marian and Julie alluded, there's that interaction between our faculty and learning how to mentor and get the best out of each of our health sciences students and helping them practice to the full ability of their scope.
Thank you all for that insight. That's very interesting. I'm curious as to just hearing from each of your perspectives as to why interprofessional learning is important for future healthcare providers and why we teach this on the campus.
Connie, that's a great question. And I think if we look at the changing practice, that really is the impetus for why we need to make sure that this is embedded in all of our curriculum. So historically, we, at least in the healthcare system within the United States, had a very multidisciplinary care setting where you may have a physician, you may have a nurse care manager, a respiratory therapist, you have your pharmacist, add in whichever specialist you need for your condition, right? And you saw each of those practitioners individually, and they may or may not even be from the same system, and so might not have access to electronic health records, and really seeing that whole picture. And I would say over the last decade, and even more specifically the last 5 years, we've really seen a push to interdisciplinary care replacing multidisciplinary care. And that's really truly where it is a team-based approach. Those different practitioners are often seeing the patient in conjunction, one long patient appointment, and each of those providers is spending time, and then they huddle and they come up with what is the best care for this patient. And I think that really was driven because we found that with multidisciplinary care for decades and decades, we spend a lot of money on healthcare in the United States, but we actually have some of the worst clinical outcomes globally. And so we really had to relook at this and say, what's happening, and are we actually providing the best care for patients? So as we've seen in practice, this move to interdisciplinary care, we realized how important it is to make sure that we change curriculum to get our future physicians and our future nurses and future pharmacists out of their silo and get them to learn together early, so that when they get out on that team and they go do team-based care, it's not new news to them. They've seen it, they've been doing it through curriculum, they've been doing it in co-curriculars and extracurriculars. And the goal is 5 years from now, we'll be thinking, why did we even have this conversation? Because it's the new normal.
And quick question, Julie. You mentioned interdisciplinary care and multidisciplinary care. Can you share for our students who are just learning about health sciences now how that looks?
Sure. I'll give a personal example because I think having an actual example is helpful. I can HIPAA disclose. I have a daughter with a somewhat serious chronic medical condition. And historically, you would go in and make an appointment with your physician. Then you would have to schedule another appointment with a respiratory therapist and another appointment with a dietitian. And with interdisciplinary care, at least for, if it's a care team surrounding patients with a specific disease state, let's say, it could be cystic fibrosis, like in our case, or it could be diabetes or hypertension, whatever the condition is, you kind of go in for one appointment. And that care team, it's long, like we're usually at the office for about 3 hours. But the physician comes in and speaks with us, and then the respiratory therapist will come and do the care that's needed. And then the nurse will come and take a throat sample and test that while we're there. The dietitian will talk to us about, not just food, but exercise and everything else. And then the physician comes back in after we know kind of out in the hall, they've huddled and said, moving forward, what's the best care therapy? What are we going to recommend continuing for the patient? And having all of those different people on that team, there's a pharmacist on the team, because a lot of it is medication therapy management along with respiratory therapies and others. And clinically, we've seen over time, and a lot of studies have shown, patient outcomes are improved. We're seeing reduced hospitalizations because of more coordinated care in the outpatient setting. People are healthier and hopefully being hospitalized less often. So that's kind of really what that means. I think multidisciplinary care is kind of each practitioner is really stuck in their silo, only kind of with their lens approach to that patient, where then when you take those blinders off and the whole interdisciplinary team is seeing that patient, you get different views and perspectives and specialties into that conversation and really end up with, I think, a much better patient care plan.
And I'll just add, from the range perspective, when we're going out and visiting the rural communities, right? Sometimes you don't have necessarily the full team. And so recognizing the capabilities that you do have within that care team, and then also being able to pick up from maybe notes or information that the patients provided because they only had limited access. Maybe only their local community pharmacy was available. And so how do we bring in the full care team and complement and step off to help the patient to the next level? So if you have that situational awareness of how the different scopes of practice, how the team should function, really you have a good baseline for how to help the patient help themselves.
I would just like to add that this isn't really just talking about what is nice for the patient. In many cases, it's talking about what's necessary for the patient. And so as nurses, we're taught to deliver holistic care. Our training is about medications and not medications as ways of treating the patient. But there's certain conditions, and the pain and opioid epidemic is certainly a good example, where if you only rely on one type of caregiving, such as medications, you may miss out on a whole host of other opportunities that could be very helpful and reduce harms. So having students come together and start to understand what each profession can bring to the table to provide this holistic framework for care is really exciting and important for our communities.
Very interesting. Thank you all for that insight. I learn something new every day. So I'm also curious, what does What can students expect to achieve in an interprofessional learning environment? And perhaps, Julie, we can start with you.
Sure. So I think in essence, it's really just learning how to work as a team. I mean, that sounds really simple, but it's really learning respect for your own profession, respect for the others, and learning those ways that you can work together as a team. I know we kind of start off within the curriculum, really kind of designing this around getting the different students to work together and understand each other's scope of practice and where those complements are. We have built into our curriculum kind of regularly scheduled activities for both nursing, pharmacy, as well as medicine, where our students are put into different scenarios. We kind of start easy with communication skills and maybe problem solving and conflict resolution. And then as those student teams work through the curriculum in each of their programs and have more advanced activities that they perform, by the end, they're at that point where they maybe have a complex patient scenario, a simulation, and they have to go in and actually provide that team-based care, take care of that patient, problem solve in kind of real time, and come up with a strong care plan. So we don't just usually throw them right into the deep end of the pool, but we kind of start with that really base understanding of each other's profession, get them comfortable communicating, get them each comfortable with being able to speak up as part of the team. Sometimes we find when we start these interprofessional activities that depending on the professional background, or really truly just depending on the individual students' personalities, sometimes some are a little more strong and the others kind of step back and say, well, I'll wait till I'm told what to do. And it's really teaching each of them when to step up and be the leader of the group. And there's not always just one designated leader.
And I could add to that, one of the things I see that is most essential is a feeling of confidence in their communications. That's so essential once they get into the workplace, that you want them to feel they have the confidence to speak up when they have something to contribute. And oftentimes people may not. They may feel like, well, the doctor knows more, and so the doctor should be in charge of the decision making here. But I think when they're learning as students, actually the pharmacy students have a whole breadth of knowledge that is unique to them, as do the nursing students, as do the physical therapy students. Then they will feel confident that they can approach a physician in a setting that might be more hierarchical and be able to feel they have something to contribute. So it'll keep them from that moment where you're trying to decide, should I speak or should I not speak? We're hoping it really encourages them to speak, because that's part of your role as an advocate for patients and also just trying to provide the best possible care.
Right, and I'll just add on, and I think Julie and Marian both touched on it, that responsibility to speak up is a huge patient safety responsibility, and of course essential to all the care that we deliver. And so, we need to form those good habits now and be uninhibited in being that advocate for ourselves as well as the patient.
And just to kind of round some of this out, we have different interprofessional experiences embedded into our curriculum. So those are the things that each student is going to get just as part of being in any of our programs. But we also recognize that a lot of students want more than that. And so we do have co-curricular, but we also have what's called extracurricular, which is kind of like fancy university term for volunteering on your own, really. Whether it's part of a student organization group that's volunteering, or you just personally volunteer. And that's really where I would say, before our students kind of get to that more advanced patient case in our curriculum with interprofessional education, many of them get experience live through those extracurricular experiences, whether they are attending an immunization event or they're going to a COVID testing event or something like that. And what we recognized early on is there was a huge barrier in our state to students being able to really volunteer as much as they wanted to, because at least for student pharmacists, being they have a state issued license to practice, as a pharmacy intern on their own outside of the program. So kind of just they could get hired by a company and work, they could volunteer, but there was a requirement that they were overseen by a pharmacist. So we had many extracurricular events where our programs and some of them that I helped precept at were pharmacy and nursing. And you would show up to an event where there would be both pharmacy and nursing students, but maybe there was something that happened and the nurse preceptor hadn't gotten there yet or had a conflict and couldn't attend anymore. And I wasn't legally able to oversee those nursing students give immunizations, even though I'm trained and authorized to give immunizations. And the same happened when our pharmacy students would show up and the pharmacist preceptor couldn't get there. And we had that same issue where a nurse or a physician couldn't oversee that pharmacy student, even though the activity was fully within their scope. And so we actually had a student-led legislative change in our state a couple of years ago that really brought this forward and said, hey, in these volunteer opportunities, we need to be able to cross precept. And if it's in my scope as a pharmacist, it's in Marian's scope as a nurse or a physician's scope, and we're overseeing that activity, it shouldn't matter which program those students come from, And I think with COVID right now, it's even more important that, we hadn't even thought about COVID. Like the pandemic was not on our minds when this bill got through. It was more kind of the mumps outbreak and measles in Spokane and immunization clinics for influenza. And I can't imagine us getting through this pandemic right now in our state without having that legislation pushed through. And again, that was a student-led effort.
That's very interesting, Julie. And do you know, I know that's a Washington state law. Do you know which other states allow for cross-precepting?
So the only one that I'm aware of is Colorado. I'm not sure if others do have it, but I don't think Colorado's is exactly the same as ours, but I think ours was the first in the country. And then, I think after that, Colorado did follow suit. Again, theirs is a little bit different. And, I haven't really tracked it recently. I don't know if some other states have done the same, but I'm assuming they're very much going to look at it when they think about provider deserts and shortages and needing to utilize any students in any program near where they are to help with the pandemic. I can see a lot of legislation coming soon around the country for just that.
Very interesting. And I'm curious for all of you, I've heard some anecdotal info. We also got a comment in our chat saying how working in a healthcare team really helps to complete the holistic clinical picture. What sort of reactions do you guys get from students when they have a first taste of interprofessional learning and their experiences?
Our students almost always say the best part of the event is that they get to work together. And no matter how much time we embedded the activity for them to work together, they always say they wish they had more. So I think that speaks to their enjoyment with it and also what they feel they get out of it.
And I'm going to put Michelle on the spot. I would love to hear just from like in practice, so outside of the curriculum, but in practice, what you've seen.
Well, we say the energy that they is definitely kicked up to a whole another level. I think having that opportunity to work as an integrated team, we do see, I think there's great feedback in terms of the relationship, just working with each other, but also from the faculty, right? The faculty precepting and just kicking up their game to a new level because they have getting a better appreciation for all of the disciplines and how to better mentor their particular college of students to facilitate those future relationships.
Really interesting. Thanks, Michelle. And I guess that's a good point to start off with. Can you share a bit more about the Range Community Clinic and how you work with the various communities to give access to healthcare?
Yeah, thank you. So our mission is really twofold. We exist for the health sciences at WSU. We are the clinical practice plan. So with that mission, we take the land grant university purpose where we're out to serve the rural and underserved communities. And that could be, as far as Orient, Washington, or maybe that's an underserved community here in Spokane. And certainly one example is the unsheltered. And through that, we have training affiliation agreements with each of the colleges where we act as a clinical site for each of them. And we set up the opportunities to provide nursing students, pharmacy students, college medical students, that interprofessional training, that clinical experience in our communities all over Eastern Washington, as well as here in Spokane. And I will say, to that end, it's so exciting and great news. We've had College of Medicine students since July of 2020. We will get a College of Pharmacy fellow in July, ready for that. And then we'll see College of Pharmacy students coming on in November. And then College of Nursing students will join us in the August-September timeframe. So really excited to have and see Range come to fruition as a clinical site. It was definitely a need that the WSU leadership saw and recognize and work to address, where WSU has this capability organically and does not have to necessarily rely on Providence or Kaiser, et cetera, as we saw in the pandemic, where those clinical experiences went away or they were drastically impacted. We have the ability to do it ourselves through Range.
Very interesting. And Michelle, are you able to share some of the most recent clinics that Range has been able to put up? Seems like they've been very critical with COVID happening and everything.
Yeah, so we had a great opportunity in Pullman, working with with all the colleges. We had preceptors and students from each of the colleges helping with the mass COVID testing that we provided to WSU Pullman. It was a 3-day effort right before the Labor Day weekend, and we tested almost 600 people. And to see the professionalism, just in the energy that came with the students was just amazing. And certainly interfacing with their peers, that's a tough spot to be in, especially in a pandemic. More recently, we see our College of Medicine students are out in working with our street medicine team. And so again, taking care to where they are. And we often meet up with College of Nursing in shelters and have that cross communication. So we're out there Monday through Saturday delivering care in some form of fashion with street medicine or the mobile unit.
And can you share more about the street medicine team for those of us who aren't aware of it?
Yeah, absolutely. So street medicine, our medical director, Louise Manriquez, and a PA who had a strong street medicine background in Coeur d'Alene, TJ Byrne, came together during COVID to see how we could help address really a COVID testing need for homeless in the Spokane area. And once we got out there, we recognized that actually there were more need of medical care, mostly wound care, and vaccinations than COVID testing. And so that effort really is beginning to mature, and we are out there Monday, Tuesday, Wednesday, Friday, and Saturday. We match up. The team is usually a preceptor, 1 or 2 students, an outreach worker from an organization like SNAP or Volunteers of America, and off and on a member from the Spokane Regional Health District. And so the outreach team decides where our teams go. And they really act as that liaison where we're providing medical care. They're there to address the other needs that they may have. The team goes out on foot. We have a backpack, right, and addresses those needs as they encounter them. It's super exciting. The appreciation that you really begin to have for those that maybe have trust issues or really just don't have the access for one reason or another. Yes, the ER or the urgent care clinic may be right down the street, but it's just not the right place for them. So meeting them where they are on their terms is so critical. And our street medicine team with that complement and really growing that interprofessional experience for them, just you can't beat it.
Really interesting. So I realize we can't really talk about interprofessional experiences without mentioning COVID because we are still in the middle of a pandemic. How has the pandemic impacted the interprofessional experience?
So I think at least from pharmacy, it's evolved over the course of the pandemic. But last March of 2020, there was definitely a negative impact just in general for our experiential. We call it experiential rotations, where students are out in community settings or they're in institutional or health system settings. And that's a lot of where they get their interprofessional, actual real world practice is on those rotations, which for pharmacy can occur a short time period in the summer in an institutional setting between second and third year, but the entire fourth year is out on rotations. And, we saw a lot of these health systems have to lock down and say, from a risk standpoint, we just can't have non-employees coming in. So not only did that impact some of our students who had 6-week rotation blocks going through their acute care, their institutional rotations, but some practice faculty who are WSU employees, but the majority of their time and the majority of their job is actually being in that health system, providing care and precepting students on rotation. Some of them weren't able to be on site as well. And so I would just say, I think faculty across all of our programs got creative in ways we never dreamed possible, kind of flip that switch and really having to design a lot of virtual interactions for our students and trying to embed that interprofessional aspect into those virtual pieces of, is it now a virtual visit with a medical student to maybe to discuss a patient case or, I don't know, it definitely got difficult, I would say. Not impossible, but it was definitely difficult. And then, as we learned more about the virus and as there was more availability of PPE to protect the employees as they went in there, we were able to see that come back a little bit. But something that I just want to point out about Range and why I think our partnership with WSU and Range is so important is that it's purposeful interdisciplinary interprofessional practice, where in some of these other settings it's ideal, but it's more kind of happens if it happens, we'll say. We might have a student on rotation and they spend their time with the pharmacist, and maybe there's they might be part of a care team doing rounds on patients in the morning, and that might be interprofessional, but then they kind of separate back out with their own cohort of students and their preceptor that has the same degree that they have or that they're going for. And so I think with Range, it's like purposely designed to get students from the different professions together on rotation and then have them being overseen by faculty from the different professions. I'm really excited to see like how far this goes for our students and looking at those interprofessional training outcomes. How are we going to measure the success of this? But I think that purpose and that intention is going to have some more consistency for our students as they're learning to practice in an interdisciplinary method.
And I'll just add to that, the pandemic definitely, I think, just further solidified the need for Range and gave us the opportunity to, I think, actually build up a little more rapidly than we first anticipated. And it was through having the street medicine opportunities or COVID testing, because we are so non-traditional, right? We don't have a healthcare facility. We don't have a fixed facility. And so because of that, we're so agile and we can create those clinical experiences on the spot, in a rapid way, and be able to flex to both the community needs as well as the needs of our health sciences colleges to provide that experience for our students. So I think it really, COVID did, as unfortunate as it is, it really helped push range to the next level, I think.
And I would like to add, we had a similar experience with the interprofessional education where we had to pivot last spring. With very short notice, we were planning an in-person interprofessional event. We had to turn it all into a virtual performance using Zoom technology. So our faculty had to get up to speed, make it work. We actually had an earthquake one of the first days that we were doing it, and then we had a power outage and we had weather issues. So we got to work through all kinds of unexpected events. But in the end, what we learned was that for some students, the Zoom technology interaction was even better. They didn't really see a difference between the in-person and the Zoom technology as far as their satisfaction with the event. And there were even some advantages. For one, of course, we can reach more students who aren't local, so that's terrific. And then also we can sometimes reach students who might be a little bit more intimidated by meeting virtually. Sometimes they feel a little bit more protected or less vulnerable. So for some, it was actually a more comfortable way to meet. So we're continuing to work on developing these interprofessional events using Zoom technology, and now bringing in our standardized patients, our patient actors. So they're coming into the Zoom technology and working with us too. So it's been a great opportunity to push ourselves to do something new and different.
And one last thing to add on this that I think has been a positive that's come from it is, Michelle kind of talked about that we kind of were pushed into the fast lane on some of this stuff with COVID. And we're seeing that also with virtual health, right? So before COVID, there was discussion of virtual health. There was, federally and at state levels discussion of, paying providers for care provided virtually, and really hadn't gotten anywhere significant yet. And we were starting to talk about it within the curriculum of, theoretically, how are we going to embed training our students to work in a virtual health setting? And then COVID hit, and we were all just like this, sitting wherever we are, but behind this fake background, right? And patients are in that same environment, and we had to learn how to teach this way. We had to learn how to do patient histories this way, and that patient kind of getting up close to the camera to show you a rash on their skin, or open their mouth and look at their throat to see if it looks like they have strep throat. Or we had to get so innovative with the technology because we had to, that now we're starting to reflect as we start thinking, what does the future look like? And as we come back to in-person education and all of these different things, what are the things that we want to keep? And many of our activities that were patient health experiences that we converted to a mock virtual health appointment, I think some of those are probably going to stay that way, because I think virtual health is moving in that direction. And we already saw reimbursement models, at the federal level addressed to make sure that providers were able to provide good quality virtual healthcare and get reimbursed similarly to if a person was in person at their clinic. So I'm just really excited, because I think that ties right in with range health as well, as providing that virtual health when the mobile unit's not out in that rural community, but that person needs some follow-up care, and how we're going to tie in virtual health. So I think there's like this whole new way that our students are going to be maybe sitting together, medicine, pharmacy, and nursing, all sitting together doing a virtual health coaching appointment with a patient. Like, I don't think that's that far off from being ready. And I think that's really exciting.
Yeah, and just, building on that, the expectation is that the telehealth and having that and being used to working with telehealth, it's out there in our healthcare facilities and in our rural communities desperately need it. And it's our responsibility to make sure our students are prepared right to walk into that environment. And so I think it's raising the bar on what we teach and what we incorporate into our curriculum, and really providing students as they graduate into the healthcare system that are demanding that their work environment be on the leading edge of technology. And so I think we're even going to see it push further. Thanks for bringing that up. That was a great point, Julie.
Very interesting. We actually have a question from our audience members. It's directed at Michelle, but I think it probably a question that all the different representatives from each college can really answer. At which point during a student's education at the College of Medicine do they begin to work with range? When are they able to join the street medicine team?
So we have primarily we are focused on fourth year MS4s, but we do have some interaction with MS3s. And I think as we see as a range gets broader, there are also opportunities for the student interest groups. I know that Julie mentioned, I think Marian too, those are other ways outside the curriculum that they can certainly be involved no matter where they are in their education.
Yeah, and within pharmacy, the experiences that we have designed are going to be, at least for now, fourth year experiences. When students are selecting their multiple 6-week rotations, we have 2 rotations that are set up with range that right now are elective because they're new and we're kind of building them. But one of them is focused on rural health, where they would be working more with the mobile unit, with the traveling around to communities and providing that rural health. And the other is geared specifically towards the street medicine arm. And so we foresee, as we kind of get that really set and up and going, it might become part of our core ambulatory care rotations that a student could select versus it filling one of their elective spots. Potentially could be both. Maybe they want to do eventually a core ambulatory care with the rural health, but they want to select an elective with the street medicine team. That's totally appropriate. But I would say, although those were in the process, this next academic year is when we'll have our first students going through that. We've had many students interacting with range from their first year of pharmacy school, second, third, or fourth, and volunteering through those student organizations. And whether they've been trained yet or not on how to do a proper nasal swab, if they haven't gone through that in our curriculum yet, then they're helping with just workflow and patient intake and kind of guiding people to the right place that they need to be for each stage of, say, COVID testing or an immunization clinic. And that, I think, at least now, is where the majority of our students have had their experience so far, has been through those student organizations and volunteer or extracurricular activities.
Thank you both. And Marian, do you know how perhaps nursing might be involved?
I don't think it's terribly standardized. We do have opportunities for nurses in the bachelor's program and in the DNP, Doctorate of Nursing Practice program. And so depending on the education that we're offering, we try to fit it into the curriculum at a time that makes sense for the type of student that we want in the interaction. So the projects I've been involved with, it can vary depending on the content and material that we're using for the case scenarios that we're doing with interprofessional education.
So I think I'm coming down to my last question, but I just want to remind audience members, if you have questions, please feel free to put them into the chat and we can answer them. Any question is basically fair game. The other question, I know that all of you have been involved in healthcare for a long time. How has interprofessional learning and experiences changed over time? How has it come to the forefront more?
Well, as I mentioned in the beginning, this just simply did not exist when I was in training. We learned in our silo, and then we were thrown out into the clinical settings where we would have to negotiate how is our relationship going to be with these other disciplines. And we didn't have a lot of knowledge about what they knew and how that might differ from what we knew. So it just did not exist 20, 30 years ago. And so to see what's happening now, I'm hopeful, because I think that it'll create nurses who do feel more confident, more sure of themselves in their discipline knowledge and how they contribute and how important they are. So it's come a long way, and I think it's a very positive change.
Yeah, and I'll just echo exactly what Marian said. It did not exist. It's not that it has changed, at least from what I recall from when I was in school, which has been a while ago. We really didn't have anything. It was the only time we talked about interacting with other providers was if you're in a setting where in a health system, you're taking a medication order from a provider and, you know, how to take that medication order from them, what information you need so that you can prepare the medication for the patient. Or in that community setting, if a verbal prescription is being kind of phoned in or brought in and you have to call them to say, hey, maybe something's wrong with this prescription. That was about all we got. We really didn't talk about the scope of those other providers, other than knowing that, like, as pharmacists, we have a law licensure exam on top of the practice exam that really is focused on, you know, which providers can do what. You know, if a nurse practitioner from out of state prescribed this, can you fill it or not? And all of those kind of things are things that pharmacists have always had to know and are tested on before licensure, but we weren't really taught how to work with one another. And I think, as I said, as we've seen practice changing towards this and how important it is that practice is moving, curriculum is moving with it. And I'm happy to say that curriculum was moving even without being told we had to. But we're also starting to see now all of our programs, the accrediting bodies that oversee our schools, they have now, it's built into our accreditation standards that we have designed purposeful interprofessional education embedded into our curriculum, and that it can't be just, you know, a couple electives here or there that some students might get. It has to actually be a base level of consistent interprofessional education that every student is graduating with. And I think seeing it from being non-existent to, hey, we're starting to see this in practice, maybe we should do it, to it really beginning in academia, and now at that point where it's an accreditation standard and there's an expectation that you not only have it, but that it's robust and purposeful. I've loved seeing that progression.
And I just add, you know, there's two other aspects to it. I think we've seen in parallel as part of that transition is the movement from treatment to health, right? And so instead of just attending to your immediate needs, but really how do we teach the patient and empower them ultimately to be responsible for their care, right? So just that going on in parallel, and as well as the business models, right? The business models, we moved from really trying to keep our patients in the facilities to keeping them more out. And so all of that kind of aligns to where we are, and we just see that interprofessional relationship, that team working together, and we know even more things will come out of it. And one of those great aspects of that will be research, right? We haven't even touched on the opportunities for research as we look at these interprofessional teams coming together. How can you collaborate on projects, or how do we incorporate something that we've learned from a recent, a grant initiative, et cetera, is really exciting. And I think one of the things also that using range is kind of that petri dish. It would be fun to see what we can do.
So I know we all wish we had a crystal ball right now. I'm curious where you all see the future of interprofessional learning going. I think some of you have touched upon it during this discussion, but perhaps Michelle, we can start with you first.
Sure. I think just picking up from that last question, I think it is, I'm excited to see how it gets incorporated into research and really furthering or empowering our patients to be responsible for their care. They are information hungry. They want to know, and how do we give them those tools, right? And set them up for success. So it's exciting.
And I'll piggyback onto that. This idea about research, I think, is important because although our accrediting bodies now say we must have IPE, I can also see a day where they say this is very inconvenient and very and very expensive. So let's not do it anymore. So we really need the research to help show that it is a good thing. It does help. It will improve communication and therefore patient safety, patient outcomes. So my team, we are involved in some research and we'll continue to do research trying to build enough evidence so when that day comes and someone questions the value of IPE, we'll have it.
And something that I am really hopeful for, and this is probably just maybe going up one of my own personal interests, but you know, we have some really great things that are being taught in all of our programs that, you know, are important. They are needed for our own specialties, but there's also these little pockets of things that really cross them. And what I would love to see, so crystal ball, I would love to look 5 years from now and see in our course catalog more courses that are not titled medicine or nursing or pharmacy, but also have some that are interprofessional. I know one that I've been really pushing and trying to get towards is I teach in the pharmacy program an elective based on policy and advocacy and understanding the legislative process and rulemaking process and how to advocate for our patients and make change. And, you know, through some of that is how we got that one law passed, where we can do interprofessional precepting. And, you know, I think these aren't things that only pharmacy students should know and understand and be skilled in, right? So our nursing students, our physical therapy students, our students in the College of Medicine, you know, should we recreate and is that a good use of resources to have something similar in each program? Or should we have one combined course? You know, I think there's some of these health policy and advocacy courses that really do cross all of the practices. And I don't know, there's so many logistics that it would be a logistical nightmare. But, you know, I think it's worth problem solving through some of that from, you know, timing and where in the curriculum students would have this opportunity. But I think those shared and pooled resources is going to also help push more interprofessional training.
And I am with you 1,000,000% on that, Julie. I think that is visionary and I think it is essential. When you take a topic such as substance use disorder, where we are doing some interprofessional team learning, you can see where the advantage is in having people learn about these topics together. That's a topic, for example, that does cross all disciplines. You're going to have patients with substance use disorder issues in all disciplines. So there's other topics like that that would be really well suited to interprofessional coursework too. So I love that idea and I hope our leadership is listening today and they can help push that agenda forward.
And if basically anyone can catch this recap of our health chats on the YouTube page, so it will live in perpetuity online if any of our leadership actually wants to catch up on that. So I'm mindful that we're rounding the top of the hour. I want to thank our guests today for joining us on this really interesting discussion. And if anyone, if you know anyone who might be interested in future health chats, we encourage our audience members to go ahead and forward on future invitations. This is really a chance for our colleges to speak to the community and educate more about what we do here. So until then, wishing everyone great health, and thank you, panelists.